Welcome to 15 Minutes with Longevity. I'm Giselle Wertheim-Ains, and today I'm broadcasting from the beautiful city of Cape Town. In the studio with me is Professor Krisela Steyn and Dr. Debbie Bradshaw, and we're going to be discussing some new groundbreaking research into smoking, and specifically how smoking relates to smoking-led deaths. This is a groundbreaking research because it's the first time in the world that we've actually seen some stats come out that lead to very specific conclusions. So I'm going to go first of all to you, Professor Steyn. You are with the Chronic Disease Initiative for Africa, and I'd like to just understand maybe what that organization is and why it is involved in this type of research.
CDIA, which is the abbreviation we use, is a network of chronic disease researchers. You know, there's so few researchers interested in chronic diseases that we actually founded this multidisciplinary network at a variety of universities. So Cape Town is involved, Stellenbosch is involved, with University of the Western Cape, University of Harvard, the Medical Research Council, that's where Debbie and I work together. And we have colleagues also in WITS, and we're looking at partners in the rest of African countries, or some other African countries.
Okay, and why smoking, just specifically? I mean, there are a myriad of obviously other lifestyle-related.
Well, smoking is probably the most important risk factor for these chronic diseases. And if you can get people to stop, or better, never start, then you can have a major impact on health in the country.
Okay, I'm going to cross to you now, Dr. Bradshaw. So you're with the Medical Research Council, and you're obviously also part of the initiative, you're a member. Can you maybe just give us a bit of background to why the research and how it's put together?
The research that we're talking about is a study that was published last week in The Lancet, and it quantifies the extent of tobacco-related mortality in South Africa. It was possible for us to do it because we put a simple question onto the death notification form. Every death that occurred in South Africa and is registered, we asked whether the deceased was a smoker 5 years earlier. And this is actually the first time that it's been done in any country to monitor the impact that tobacco is having. So we do know that tobacco is harmful, it's not new, but this gives us a way to measure that impact.
I'm very interested that we are the first country to do that, because one would assume it's such a pervasive health issue around the world that more developed countries with more resources would have done this sooner. How has it come about that we have led this?
I think South Africa has been leading in tobacco control in many ways. In the late 1980s, the Medical Research Council was involved in costing the impact of tobacco. So the ill health that it causes and the need for health services. And that helped to motivate the incoming government in '94 to regulate around tobacco control, and we started to see banning of advertising and increasing of taxes. And it was at that time that we also were able to convince the government that it would be useful to start monitoring. I think with tobacco, they're vested interests, and so governments do find it difficult to move in a certain direction. But South Africa was very brave at that point and went ahead.
So let's now talk about what you have found in this research that you think is notable and which leads to very specific
interventions.
Yes.
Yeah, I think the main kind of highlight finding for us, because as I said, we all know that tobacco causes ill health, but what really surprised us was the extent to which it's hitting the coloured community in South Africa. The tobacco-related mortality was double for coloureds compared to whites. It's not only through the cancers and the heart disease that we're very familiar with, but it was also through tuberculosis and other chronic lung diseases that it's showing up. So one of the key messages for the South African community is in the Western Cape, the Northern Cape, to make sure that we changing behaviors of individuals.
And is there something specifically underlying the social behavior in this community around smoking?
Kids grow up in families where grannies and grandpas are smoking and mums and dads are smoking, and it just continues, it perpetuates. So Krisela and I were involved in a study in 1998 looking at the prevalence of smoking, and at that point we could see that the quitting rates amongst the white community was higher than it was amongst the coloured community. So our messaging is not getting through to everybody in South Africa.
Because when you look at some of the other really positive highlights, I mean, I see that overall there has been a dramatic decrease in smoking. I mean, nearly halved the overall general incidence from the late 80s. And that has to be a result of advertising legislation and the taxes, surely, and perhaps more health awareness. Is this now a justification of what happened in terms of legislation, and how it can have a hugely positive impact on health policy?
South Africa was one of the leading countries in reducing smoking rates so dramatically. And it is the impact of the legislation, as you suggest. And it has really been felt in the groups we wanted to reach most. Because of the taxes and therefore the prices go up, we had a reduction of smoking mostly in the poorer sector of society and the young sector of our society, because they could really no longer afford cigarettes so much. But it is still not sufficient in the younger group, particularly because their rates of smoking have sort of stabilized, and they are not responding to the legislation in the long run to the extent that we would like them to. And this data really shows us that we have to support young people to stop smoking, and preferably never start. Because if you start smoking when you're in your late teenagers, early 20s, and you go on smoking for the rest of your life, your chance of dying because of smoking is about 50%. So the sooner we start and the longer we can get young people not to smoke, the better for the health in the country.
And that's, of course, quite a dilemma, because it really works against the whole genre of being young and being rebellious, probably wanting to experiment. Dr. Bradshaw, the numbers that you've seen, I mean, do you have hope that there's great progress being made?
The last year we had a look at a whole range of risk factors, the risk factors for chronic diseases, and most of them are going up. So the obesity, hypertension, and the fat content in one's diet, and all those factors are leading towards ill health. The only thing that did show positive improvement was the smoking. But I think, as Krisela is saying, the young kids, the surveys that show collect data from children at school, is not showing any improvement. It's in fact going up.
Is that a specific school-going age?
It's the grade 8 to grade 10 kids.
Sure.
And it's particularly the Western Cape stands out as being very high as well. The other angle that I think is quite important for South Africa is to support cessation programs that will help people quit. So in the health sector, to enable primary care practitioners, the nurse or doctor, to be able to fairly quickly help patients to get onto a program of quitting. And also the products that are available should be provided in the public health sector. So the nicotine patch.
The ones that really try and substitute.
Yeah. Yes. Yeah, we would like to see that on the essential drug list.
Okay. So just going back to you, Professor Steyn, looking at we spoke about addiction earlier, and we know that this is really what happens to people. Once you start smoking, it's very, very difficult to stop it. So How we're moving towards more of a public healthcare system with the NHI, so we may have some of those interventions. But again, in the general health awareness space, is there anything more that could be done just around creating that awareness for the South African public?
Well, we know what the Australians have done. They have put the most terrible warning pictures on their cigarette packets, so that I think one really could really use more visual impact information on cigarette packets, which we haven't in South Africa at the moment. We've got verbal warnings on our cigarettes. So that would be one thing. But the most important is for us to implement the regulations we do have. People get away by breaking the law, and we're not going to have the effect we want until we implement them very strictly.
And when you say breaking the law, you're referring to selling cigarettes to minors, or smoking in public places, and
smuggling cigarettes.
The smuggling cigarettes is a very interesting one, because I think there's that whole debate around if you push the price of cigarettes up, all that you're going to do is create this huge black market for cigarettes, which no one can control.
Yeah, although it's as far as it can be estimated, the smuggling is not as big as anticipated, or as the tobacco industry makes out it to be. But it is really implementing the regulations and helping people who smoke already to quit. Because we all know that the whole norms of behavior have changed. People don't just blandly walk into your house and light a cigarette or in a public place. People now often ask, or they know they go outside and they smoke outside. So it's those norms that we'd like to implement. And also for the young people, that young people can start understanding it is really not a cool thing to do.
Well, that's all we have time for today. Next week, please join me in the studio for a discussion on scarring. I'll have in the studio with me a dermatologist and a plastic surgeon, and we'll be looking at the way that scarring affects one's health. Be healthy, be happy, and have a great week.